Hello, I'm Dr. Ziad Al-Zahrani, consultant rheumatologist.
Hi, I'm Professor Susan Attar from Saudi Arabia. Pleasure to be here. Three important unmet needs in rheumatoid arthritis patients who failed the first anti-TNF therapy. First of all, about 40 to 60% of patients, they do cycle within the TNF inhibitor. But unfortunately, 50% of them, they do not respond either to lack of efficacy or developing a side effect. So we do need an important RCT head-to-head trial, and that's what the SELECT switch will show. When a rheumatoid arthritis patient fails the TNF inhibitor, the most important question, what should we do next? Should we cycle within the same TNF or should we move to a different mechanism of action? This important question, we have been based on many retrospective or even prospective cohort, but the SELECT switch study present the first RCT that answers such a question.
Ubadacetinin 15 milligrams once daily plus methotrexate was compared with adalimumab 40 milligram every other week. 55.8% of the patients were primarily non-responders to the prior TNFi, and 44.2% of the patients were secondary non-responders to the prior TNFi.
So let's look at the result. Please pay attention to the screen. Two things to look at. First of all, the low disease activity and then the remission rate. 43 versus 22% of the patients cycling versus switching to a different mechanism of action. And with regard to the remission, and that what we care as a rheumatologist, 28 versus 12% of the patient.
Patients experienced better disease control. They also experienced greater joint relief and less pain.
Let's move on to the side effect. If you compare both groups, number one, we care about the serious infection, which occur in 0.8% of the cases. Now, what about the serious one? That is the DVT, PE, as well as the MACE. Again, look at the table. There were no reported cases at the end of 12 weeks. So in conclusion, for the patient who do not respond to the TNF inhibitors, the SELECT switch study provide an important option and consideration about what to do next, which is going for a JAK inhibitor rather than cycling to the same TNF inhibitor.
Ubadacetinin plus methotrexate demonstrated rapid and superior efficacy versus adalimumab plus methotrexate.